Do women experience hormonal changes during the menstrual cycle? What is the impact of the perfect body culture on female sexuality? Hello to all lovers of psychology and sexuality. Today, we will unveil the sexual curiosities of women. If you are interested in these topics, make sure to subscribe and activate the notification bell to not miss our future videos. Also, leave us comments and share your experiences in the section below. Let's get started. Yes, women experience hormonal changes during the menstrual cycle. Estrogen and progesterone levels fluctuate throughout the cycle, affecting sexual desire, vaginal lubrication, and other aspects of sexual response. The culture of the perfect body can have a negative impact on female sexuality by creating unrealistic pressures and expectations about appearance. This can lead to insecurity and affect self-esteem and sexual intimacy. Academic research. The Kama Sutra is a subject of study in academia, where its historical, cultural, and sociological aspects are analyzed to better understand its impact on contemporary society. Addressing female sexuality. Unlike many historical texts on sexuality, the Kama Sutra dedicates significant space to exploring the pleasure and sexual needs of women, making it an important reference for understanding female sexuality today. Adult entertainment industry. Fetishes are a popular topic in the adult entertainment industry, where films, magazines, and online content are produced specifically to cater to the fantasies of those with diverse fetishes. Age and erectile dysfunction. Although more common in older men, erectile dysfunction is not exclusive to advanced age. Men of all ages can experience it due to a variety of factors, including physical and psychological issues. Age fetishism. Some individuals experience sexual attraction towards people of certain ages, either towards young adults, juvenilism, or towards older individuals, gerontophilia. Social stigma. Despite its prevalence, pornography remains a stigmatized topic in many societies, which can hinder open and honest discussion about its impacts and practices. Speed of arousal. Men can have a complete erection in just 10 seconds, and sometimes they only need to look at something that stimulates them for a few seconds. In contrast, women require stimuli more related to the brain, such as emotional intimacy and connection. STDs and cancer. Some STDs, such as HPV, are associated with a higher risk of developing cancer, such as cervical cancer, anal cancer, and penile cancer. Studies on the clitoris. Despite the importance of the clitoris in female sexual response, there has been a lack of research on this organ compared to the penis. However, there has been an increased focus on clitoral research in recent years. Taboo and acceptance. Some cultures may consider certain fetishes taboo, while in others they are more accepted or even celebrated. This reflects cultural differences in the perception of sexuality and individual expression. Technology and virtual reality. Pornography is undergoing technological advancements, such as virtual reality, offering more immersive and realistic experiences for viewers. The concept of positive sexuality. Positive sexuality refers to a respectful, non-judgmental, and empowering attitude towards sexuality, which promotes pleasure, equality, and consent in all sexual expressions. The effects of stress on sexuality. Stress, anxiety, and other emotional factors can affect libido and sexual function. It is important to recognize and address these factors to maintain a healthy and satisfying sex life. The health benefits of sexual activity. Consensual and pleasurable sexual activity can have numerous health benefits, including stress reduction, strengthening the immune system, and improving mood. The importance of consent. Mutual consent is fundamental in any sexual activity. All parties involved must give their consent freely and consciously before engaging in any sexual activity. The importance of self-exploration. Knowing and exploring one's own body is essential for a healthy sexuality. Self-exploration can help people understand their preferences, limits, and sexual desires. The influence of religion on sexuality. Religious teachings and moral norms can have a significant impact on people's sexuality, potentially causing internal conflicts between religious beliefs and individual sexual desires. The internal clitoris. The clitoris is not just the small visible button at the top of the vulva. It has an internal structure that extends into depth. Stimulation of the internal clitoris can be an additional source of pleasure for some women. The prevalence of sexual disorders. Sexual disorders, such as erectile dysfunction or hypoactive sexual desire disorder, are common and can affect people of all ages and genders. The sexual toy industry has experienced a boom in recent years, with a wide variety of products designed to enhance sexual pleasure and intimacy for couples. Time and patience. Anal sex requires time, patience, and gradualness. Rushing can result in discomfort or pain. Toys for female ejaculation. Some sex toys are designed to help women experience female ejaculation, also known as squirting, by stimulating internal erogenous zones and promoting the release of fluid during orgasm. Toys for sexual rehabilitation. Sex toys are sometimes used in sexual rehabilitation programs to help individuals regain sensation and sexual function after injuries or surgeries. Treatment. Treating anorgasmia may involve sexual therapy, cognitive behavioral therapy, hormonal therapy in cases of hormonal imbalances, medications to address underlying medical conditions, or a combination of these options. U-spot. In addition to the G-spot and P-spot, some people believe in the existence of the U-spot in women, located on the front wall of the vagina and considered highly sensitive. Use of condoms. For some men, using condoms can help reduce penile sensitivity and thus delay ejaculation. However, for others, it may have the opposite effect. Variability in coital. Duration. The duration of coitus considered normal can vary widely among individuals and cultures. There is no specific time that defines premature ejaculation, but rather a subjective experience of dissatisfaction. Variability in preferences. Masturbation preferences and techniques can vary widely among women, and what works for one may not be effective for another. It is important to experiment and discover what feels best for each individual. Variability. The male orgasm experience can vary in intensity and duration. Some may have more intense or prolonged orgasms than others. Variety of genres. There is a wide variety of genres and categories of pornography, ranging from conventional to extreme, allowing viewers to find content that suits their sexual preferences. Versatility in relationships. The Kama Sutra is not limited to heterosexuality, but also offers guidance for same-sex couples and individuals with diverse gender identities, making it an inclusive guide to sexual diversity. Human sexuality is a fascinating and diverse field that never ceases to amaze us. Sexual curiosities unveil the wonderful complexity of the human experience in the intimate realm. As we explore and understand these facts, it is crucial to remember that each individual is unique in their sexual experience. Respecting and communicating with your partner are the keys to a satisfying and healthy sexual life. Sexual education and understanding are essential tools for fully embracing our sexuality.